और उसको सिर्फ एक
A. Infancy. B. Adolescent. C. School going age. D. First trimester of pregnancy.
Maximum development of the brain occur at infancy.
Correct answer. From birth to age 5, a child's brain develops more than at any other time in life. And early brain development has a lasting impact on a child's ability to learn and succeed in school and life. Bone dysplasia is due to a. Correct answer. Bone dysplasia is due to faulty development. It is a group of genetic disorders that affect the growth and development of bones. Bone dysplasia can cause a variety of symptoms, including short stature, bowed legs, and joint problems. There is no cure for bone dysplasia, but treatment can help to manage the symptoms. Hormone responsible for skeletal maturation of fetus. Correct answer. Thyroid hormones are known regulators of adult metabolism and are important in driving several aspects of fetal development, including muscle fiber differentiation. Percentage of polio infection which are asymptomatic. A. 10%. Correct answer. A child takes self-decisions at the age of. Correct answer. Children start to develop the ability to make their own decisions around the age of 7. This is when they start to develop a sense of right and wrong, and they can start to understand the consequences of their actions. The reference protein is A. Rice. B. Correct answer. A reference protein is a standard to measure other proteins. Egg protein is one of the most digestible proteins and has been used as a standard given a value of 100 to compare other proteins in terms of their digestibility. A newborn failure to pass meconium within the first 24 hours after birth may indicate which of the following? A. Celiac disease. B. Hirschsprung disease. C. Correct answer. A condition of the large intestine that causes difficulty passing stool. Hirschsprung's disease involves missing nerve cells in the muscles of part or all of the large intestine A child presents to the emergency room with the history of ingesting a large amount of acetaminophen for which of the following would the nurse assess? A. Frequent urination. B. Hypertension. C. Right upper quadrant pain. Correct answer. The nurse is aware that the most common assessment finding in a child with ulcerative colitis is A. Anal fissures. B. Profuse diarrhea. Correct answer. The most common assessment finding in a child with ulcerative colitis is profuse diarrhea. The main symptom of ulcerative colitis is bloody diarrhea with or without mucus. Failure of the foramen oval to close with cause what congenital heart disease? A. Atrial. Correct answer. A fetus has fine downy hair which is called A. Amnion. B. Vernix caseosa. C. Corion. D. Lanugo. Correct answer. Lanugo is a fine, downy hair that covers the body of a fetus. It is the first hair to grow on the fetus, and it usually appears around 16 weeks of gestation. It is normally shed before birth, around 7 or 8 months of gestation, but is sometimes present at birth. It disappears on its own within a few weeks. Neonative diabetic's mother is at risk for all of the following except A. Hypoglycemia. B. Hyperglycemia. Correct answer. Neonates of diabetic mothers are at risk for hypoglycemia, hypocalcemia, and hyperbilirubinemia. Hyperglycemia is not a common complication in neonates of diabetic mothers. In children, which disease occur due to protein deficiency? A. Marasmus. B. Kwashiorkor. C. Correct answer. BCG vaccine is given to prevent A. Tuberculosis. Correct answer. In children, which is the most appropriate route for measuring temperature? A. Oral. B. Rectal. C. Elbow. D. Axillary. Correct answer. The axillary route armpit is the most common and preferred method for measuring temperature in children. It is easy to use and does not require any special equipment. The thermometer is placed in the center of the armpit for 3 to 5 minutes. The rectal route in the rectum is not recommended for children under the age of 2, as it can be uncomfortable and traumatic. The thermometer is inserted into the rectum for 1 to 2 minutes. Anterior fontanella is ossified in A. Soon after birth. B. At 18 months. Correct answer. The anterior fontanelle is a soft spot on the top of a baby's head. It is made up of spaces between the bones of the skull. These spaces allow the skull to flex during birth and grow as the brain grows. The anterior fontanelle usually closes between 12 and 18 months of age. In following which vaccine is given at birth by intradermal route? A. OPV. B. BCG. C. DPT. No. Correct answer is B. First booster dose of DPT is given at A. 10 weeks. B. 14 weeks. C. 5 to 6 years. D. 16 to 24 months. Correct answer. All children should get 5 doses of DTP vaccine as per the schedule. 6 weeks, 10 weeks, 14 weeks. First booster 16 to 18 months. Second booster 5 years. Which of the following fontanella in child is the first to close? A. Frontal. B. Mastoid. C. Sphenoid. D. Occipital. No. Correct answer is D. Babies are usually born with 6 fontanelles. They are in different places around the skull and close at different times throughout childhood. The posterior fontanelle usually closes first, followed by the sphenoidal fontanelles, mastoid fontanelles, and anterior fontanelle. When physiological jaundice appear in newborn baby? A. At birth. B. First week after birth. C. On second day. Correct answer. Most newborns have some yellowing of the skin, or jaundice. This is called physiological jaundice. It is usually noticeable when the baby is 2 to 4 days old. Most of the time, it does not cause problems and goes away within 2 weeks.